Is feeding the only thing that's likely to lead a parent to believe they might have a tongue-tie problem, or could there be other signs?
Yes, so now we're attributing sleep difficulties. So in the newborns and infants, colic, reflux, difficulty with bottle feeding, and then breastfeeding and bottle feeding. But the hiccups, I've had people come because they're concerned the baby's got hiccups, but very much so a lot of colic and reflux at the moment is the kind of the buzzwords.
Right, so just to clarify, these are the signs that people believe indicate tongue tie, but they're not things which are necessarily, or perhaps in any way, connected with tongue tie.
Absolutely. So with actual cases of tongue tie, there can be a correlation with those things. There's been studies that have shown correlation, but what's happening is people are having the symptoms that they believe to be reflux or colic, and then assuming it must be attributed to tongue tie.
Well, I suppose if you've got a child which is showing colicky symptoms, and I don't know about you, but for osteopaths and chiropractors, colic is a dodgy word. We're not allowed to use that in anything in our websites or marketing to suggest that we might be able to address the symptoms, which is unfortunate because there's a lot we can all do to help with those symptoms. But so if a patient is seeing that in their child, it is reasonable for them, isn't it, to say, well, I want to rule out tongue tie if it is a potential component.
Yeah, absolutely. And I'd be very happy for people to come to me to rule that out. But even when tongue tie is present, it is part of the puzzle. So I think there's an interesting thing around language. So if a parent has consulted with an osteopath, for instance, and they're saying the baby's unsettled, they've got hiccups, they're not latching well, sort of whatever the symptoms, I think the important thing is to say, you could have a tongue tie assessment with a tongue tie practitioner, as opposed to, oh, I think there might be a tongue tie, or see somebody to get the tongue tie fixed. So what I really want to see is clients coming in saying, we have some symptoms, we've seen another practitioner, they've referred us on for further assessment so that you can do a full assessment of, oral function, rather than coming for frenulotomy or coming with tongue tie in their mind.